Our next speaker for the day is a very dynamic Canadian lady. She is a gynecologist and a laparoscopic consultant. She studied from King's College London. Please welcome Dr. Professor Yasmin Sardar and see what she has for us today.
Bismillahirrahmanirrahim. Assalamu alaikum, ladies and gentlemen, and women of the whole world. I'm Professor Dr. Yasmin, Canadian Pakistani. I'm very honored to be here and to be part of this international conference on women health. I would congratulate the organizing team of Berkeley MS, the Voice of Global Women UAE, who organized the conference on a very special subject. And I would like to thank you, the host of the conference, Dr. Musa Sheikh. I'm also delighted to share that Musa is one of my alumnus from King's College London University. I'm a survivor of severe depression, anxiety, suicidal attempts. This picture I'm sharing is from my late son, Gohar, who passed away in an accident in Canada, Ottawa. It's a very important message I want to give for the mental health of the women. In mental health, once you are struck by depression and anxiety, never feel you are alone. You are being supported by friends, family, community, and multiple people around you. So my journey, this was the last picture of myself and Gohar, my late son. So behind the journey of depression that led me to the cause for support of women health, towards the building of IANA, empowering women, you are not alone. IANA means you are not alone. So today we will talk about that how can we diagnose or how can we predict the mental health in women, prevent it, and if diagnosed, how to treat, and how the woman can make that depression to come out of it and make it a vision. It also led me to thinking of my recent patient who reminds me who killed herself during the pregnancy because she struggled in isolation. She didn't seek help. She tried to hide her condition from the family to support her, to support the family, not to raise it and to trouble the family. The other one attempted suicide, but we saved her. And I'm so glad today she's a mother of a beautiful boy, and they are saved from almost psychotic condition to back to normal life. So it is generally said that pregnancy is joyful. Yes, it's a joyful experience of having a baby, but it's also yet pregnancy is vulnerable for mental health. And it's very common. It's 1 in 5 women experience depression and anxiety. Our platform advocates holistic maternal wellness, mind and body, spirit, in line with the WHO Maternal Mental Health Report of 2023. It's important to understand the spectrum of mental health issues. Initially, there is sadness, and it can lead to maternity blues, postpartum period, and if ignored, very common to undergo depression, postpartum depression, psychosis, and as I just mentioned, suicide. It is the third leading cause of death among people aged 15 to 29 years in general. Mental health issues was responsible for 23% of pregnancy-related deaths. 31.3% of these deaths, they were due to suicide. A significant number, alarming figure. Look around yourself, assess yourself. If you have the mood problem, please share it. Do not stigmatize. Make your voice louder. I myself was having suicidal ideation when I lost my son in Ottawa. My career during residency training program, it was at risk. I was facing multiple issues. I tried to not bring my depression in the family, silently struggled many years, quietly. My youngest daughter, Chanel Khan, who is the founder of this platform, she used to watch me and she decided that depression could be preventable, and it is preventable, and we need to help and raise the voice. So the most important thing is recognition. Depression during the pregnancy can be in the form of antenatal depression, anxiety disorder, where women are very stressful, worried about their health and the baby's health, anxiety and postpartum depression. And that can lead to unrealistic situation. One of my patient I mentioned to you, she went to psychosis to the extent she was having ideation to kill her baby. She thought her pregnancy caused disfiguring and she will never give the milk to the baby. And this baby has changed and ruined her life. It's not that they don't want to live. It's not that they are hating their family. It's just the overwhelming pain of being alone. Today, our goal is that by the end of today's talk, we plan an action and the message to take. Work together, because when women work for women, it becomes the mental health could be pleasure to deal with. In prevention, like in any health issues, the mental health issues management starts with identifying risk factors. As you know, pregnancy has hormonal changes and these biological factors, that there are hormonal changes in the estrogen, progesterone, thyroid, particularly cause low mood. It's very important to take a good history of psychological risk factors. Did she have a history of depression? Is anyone in the family has depression? The most important factor that studies have shown that domestic violence and lack of support is the number one cause of mental health issues in women. The screening factors, the studies have shown that there is an Edinburgh post it is screening QHP9 forms. These are the validated tools for screening and they are recommended. It can lead to premature deliveries, low birth weights, and developmental delays. Infant bonding, maternal bonding, and then because mom is sick, the baby cannot thrive, and there can be a marital relationship at risk. And these are very avoidable. How we can, by using this, as I just mentioned, Edinburgh scale, PHQ, generalized anxiety disorder screening, and it must be performed by all obstetrician, residents, trainee, healthcare professional, whoever come across with the intact of the woman. So preventing strategies promote emotional wellness, encourage sportive relationship, nutrition, sport, mindfulness therapy. When the woman comes, I use those screening forms to identify the woman at risk. And I think generally all women, I find that they have depression, which they hide. But the moment you touch them, the moment you ask them, they are open. And I always see the couple, not women alone. I create the group where I am available to them. My team is available to them. So coming back to how these build the supportive relationship through this conference, one of my message will be, please practice holistic approach. Here is that I'm sharing what model we use for the mental health. I would urge and I would request and I would plead, please, please, please integrate mental health screening in your antenatal care. If I say one most important message of today's conference, it is the identification and approaching this one. The holistic model of care, the YANA approach, as I said, the GMS solution has given birth to my clinical practice after long period of depression. Recently, I started a year ago, YANA, which means E is empowering, YANA means you are not alone. And here is a model says your awareness, nurture, and acceptance. So not only physical health in antenatal care, in the gynae clinic, in the general GP practice, emotional resilience, community support. There are always community, and we should work through our community development, engage our youth in education and health. They will be so happy and we can generate healthy. So my closing thought is that the healthy mothers raise healthy generations, and let's nurture mind as we nurture lives. The GMS Solution Canada is a platform of health and wellness. We are so thankful to Berkeley Global Voice of Women UAE. And through this platform, since we envision the same, I would be very happy, will be honored to request Her Excellence Arifa Al-Falahi, Dr. Musa Sheikh. So my closing message here is that mental health issues are common. We need to identify it, and we need to take home the message that identifying the risk factors and providing supportive environment, providing holistic approach, not only physical health, but emotional health and the nutrition, not only the nutrition, yoga, meditation, and involving the husband and their family, both sides. It goes a long way. Thank you.
Thank you, Dr. Yasmin. It was lovely to hear about your thoughts, and you are such an example of women in leadership, women in healthcare, and your impact in society is amazing. Please keep this great job always continued. All our support is with you. Thank you very much for joining us today, and I'm excited to hear you more in our next shows. So with this, ladies and gentlemen, we are almost at the end of our conversation. This is a very serious issue which we talk about, and we saw some professionals who are creating an impact in the society. We need to work on it. We all has to come together for our sisters, for mothers and daughters who has to pass from these conditions, because the physiology of their and the anatomy of their bodies, and we men has to understand and support. It's a combination of life where a man and woman supports each other. There are mental issues in men, there are mental situations in women. We have to understand, we have to talk about it, and we need to sort it out. We need to open up. We don't, silence is killing men and women. So we have right platforms. If you are struggling with the mental health, Berkeley Voice of Global Women is here for your support. With this promise that wherever you are, whatever you do, always take care of yourself and your people around you.